Welcome to Observations, an open conversation about women's health. This is a space where physicians, patients, and other experts can sit down and have honest, evidence-based dialogue that cuts through the media bias and brings clarity back to maternal care and how we can care for both patients, mother and preborn child. With each episode, we will have real stories, real science, but also real questions about women's health today. From clinical insights to lived experiences, to aligned perspectives, and yes, also respectful disagreements. This is our goal, to bridge the gap between physician and patient, to empower informed decision-making, and bring back and elevate compassionate, fact-driven care. Now, a quick note before we dive in. Not every guest on the podcast is going to represent the views or positions of AppLog, but we believe that having open and honest conversations are going to make us better. So, grab your coffee, settle in, and let's get into today's observation.
Welcome. I'm your host for today, Dr. Christina Francis, and joining me to co-host is Jordan Butler, our communications manager. This is a really fun episode because we are hosting from both a physician and patient perspective to offer our observations on today's topic, which we think is definitely gaining in interest and popularity. And we are so thankful to have with us today Dr. Monique Ruberu. Monique is a board-certified OBGYN and Creighton Fertility Care medical consultant since 2015. While Dr. Ribeiro has served as an OBGYN since 2008, she transitioned to Napro Technology in 2015 to align her practice with her belief that all life is precious from conception to natural death. She got her undergraduate degree at the University of Dallas and her medical degree from the University of Texas, and completed her OBGYN residency at Drexel University in Philadelphia. After a research fellowship and practicing at Holy Redeemer Hospital, she founded her own practice where she focuses on the root causes of fertility and women's health. And last but certainly not least, she is a devoted wife, mother, pro-life advocate, author, and Catholic Speakers Organization member. So Dr. Ribeiro, thanks so much for joining us today to get into all kinds of questions about Napro technology, fertility, PCOS, and lots of other things.
Thanks so much for having me. Happy to be here with you guys.
Absolutely. Well, let's jump right in because I know that we have a lot of questions, a lot of information that our listeners are going to want to know. So first of all, we talk about Napro technology. We may have listeners, viewers who just aren't even sure what that is. So can you just explain to us what that means?
Sure. Napro Technology is a shortened version of natural procreative technology. And so this is basically Tom Hilgers came up with this concept of being able to watch all of the different biomarkers. So your bleeding patterns, your mucus patterns throughout the cycle to be able to identify exactly when you're ovulating and then to check hormone levels according to that point of ovulation. As you know, as a gynecologist, when we were trained in the typical allopathic method, oftentimes when people are asked to check hormones, they will say, oh, go just check a day 21 estrogen and progesterone level. Instead, using Napro technology, we're very specific as to when we check labs, how we evaluate the cycle. We understand the true meaning behind all of the different symptoms that your body is trying to give. So, the color of bleeding, the quality of the bleeding, the color and quantity of the mucus, the timing of all of these things. So it's really in depth, really amazing.
Yeah. No, it's so amazing. And listening to you talk about that too, I think many people probably think, well, as an OBGYN, wouldn't you learn that as part of your training? And as you alluded to, we don't actually. I mean, oftentimes we're taught, like you said, check hormone levels on day 21, and you sort of make all of your decisions based on that one point in time. The most we really learn about in sort of charting cycles, maybe if you're lucky, is having a woman chart her basal body temp and looking for evidence of ovulation just based on that. But that really is all we're taught in sort of our traditional residency programs.
So true. I remember actually being a medical student and then a resident and being told multiple times that natural family planning methods do not work. Don't even look at them. There's no reason to ever go there. And I think that it wasn't that, the physicians who were teaching that were unkind or angry or anything like that. It's just that the system is a little bit broken and they're basing those statements on prior methods of natural family planning, where it was extremely convoluted and difficult for patients to use. But now we have these amazing methods that are so, so accurate and they give so much information to the patients and the providers. It's beautiful.
Yeah, absolutely. Well, and I think what I love about it as well is it isn't even just about fertility and,
Absolutely.
helping women either achieve pregnancy or avoid pregnancy if they're not quite ready for that at this point in time, but it can tell us so much about just their general health and so many other things, about things that might be impacting their cycles and again their long-term health. To me, that's one of the things that's so fascinating about Napro Technology. But what in particular sparked your interest, and then what did you do to be trained in this? Because as we said, we don't get it in our sort of traditional residency programs.
Yeah, it's interesting actually. Napro Technology was a part of my kind of fully stepping into my faith. So my marriage had been on the brink of divorce at about 10 years, and God brought amazing people into my life and helped me to heal that marriage. And when that was healed, I decided to go and pray outside of an abortion center. It was at that place that I encountered someone who gave me a book about Napro Technology, and I had never even heard of this before. So I read this book and I was blown away by treatments for ovarian cysts, treatments for postpartum depression, treatments for fertility that I had never heard of. And there were studies that were backing them up. And so I instantly, reached out to the Pope Paul VI, St. Pope Paul VI Center in Nebraska, and I asked them if I could join their program. And it was a year-long study for physicians. You go twice in person for about a week, and then you do a lot of self-study, and then there are tests involved and whatnot, and then a practicum at the end and presentations and all of these little different components. It was a phenomenal experience. It felt like a retreat every time I went. And I learned so much more than I had ever known about hormones, about tracking, about just GYN health, because I was taught pretty much to address everything with contraceptives.
Yeah. Yeah. Yeah, absolutely. It's one thing that I think a lot of people outside of OBGYN or who haven't been through that training maybe don't realize is that so much of what we're taught, and and this is completely separate from if someone has maybe a theological objection or a moral objection to oral contraceptives. I mean, just the fact that we are just trained to just throw birth control pills at nearly everything that's wrong with women. Nearly every complaint that they come into our office with, like, oh, a birth control pill will fix that. And again, it's not coming, as you said earlier, it's not coming from malicious intent, or for most people it's not coming from like a profit driven motive or anything. Like, we are products of our training, and that is what we are trained in. And I know so often I don't see patients in the office anymore, as I work very part-time as a hospitalist now that I do a lot of work with Applog. But I remember feeling oftentimes very frustrated as the physician with the patient sitting in front of me, because I felt like I had very few tools in my tool belt to be able to help her. I might be able to check some thyroid hormone levels, and if I was really lucky, maybe her TSH would be off, and then I'd have something that I could do, to try to help fix what was going on with her. But it was really frustrating because it was just kind of this band-aid fix, like, we're just going to basically mask your symptoms by putting you on a birth control pill, and then you'll feel like you're doing better. but ultimately we're not really fixing anything. And that's one of the things I love so much about the Napro technology approach, is that it really is looking at what is the root cause of what's going on and how can we get at that. Um, if you I'd just love to hear what your experience has been, just briefly, or you can expound on it. But not only from a physician, I feel like it has to be so much more satisfying being a physician and being able to like truly help heal your patients through this. But also, what have you seen the difference in response of your patients as well once you switched your approach to this?
Oh, I can tell you just hours and hours of stories upon stories. It's just such a joy to be able to practice in this way. And it's interesting because my journey began with Napro Technology, but Napro Technology really just opened the door for me. So, after understanding how the cycle works, what are the basic things that we're looking out for on the charting, I also noticed that there was more to it. So besides just understanding where a person's estrogen and progesterone are, you have to start wondering when they have abnormalities with high estrogen in particular, why is that happening? Right? We're not the majority of women are not major estrogen producers. We're all producing the correct amount of estrogen. However, there are women who are not clearing the estrogen out. And when you look at the way integrative doctors work, and they're looking at the gut, and they're looking at the liver, and they're looking at how often you go to the bathroom and have a good bowel movement, and what you're drinking and what you're eating, that made so much sense to me. So I would say in my practice, even more than just Napro technology, I kind of really seek the root cause of everything. So if somebody has PCOS, thyroid dysfunction, all of these things, I absolutely look for those things. But the deeper root is actually the toxicity that we're exposed to that has oftentimes led to the dysfunction, and trying to help patients understand how to change things in their diet, how to change things in their exercise and their habits so that their body can actually recover. Because I truly believe that God created our bodies to heal, and that we have so many mechanisms inside our bodies that are constantly trying to heal us, but we get in the way. And if we're not listening to our bodies, if we're not, checking these labs, then we won't really have an understanding of what is truly going on. But it's been just an amazing journey for me to go from being a physician who would see a patient probably in 15 minutes in my office
Sure.
and, write a contraceptive pill, to a physician that every patient gets 30 minutes across the board. And when they come in, they're all just stunned at the depth of the questions during the interview and how we evaluate the bleeding patterns, and how we respond, which blood tests we are interested in looking at. And then when we get the blood test back, how we're not just looking at the values according to LabCorp requests, but we're actually looking at the optimal ranges and then guiding our future changes in their management based on their symptoms in addition to the optimal ranges. So it's a very, very different style of practice. And even in Napro technology, not everybody goes to that same depth when it comes to utilizing, different supplements or cleansing methods, or advising people not to drink caffeine. So my practice is very different for sure, and it might not be for everyone, but the people who are there really value it.
Yeah, I bet. I bet.
And that's really interesting to me because from a patient perspective, when I hear what you're talking about, as someone who's, been in the OBGYN office probably since I was about 19, and them again looking at my thyroid levels, that's how they found out I had hypothyroidism. Um, but when they were basically like, "Oh, you have PCOS," the first thing they literally did was put birth control on it. That was exactly what they did. And I've since gotten off birth control, But I always think to myself, man, I really wish that I had been given the option, or that maybe doctors had known about the option of trying to heal more naturally so I could have gotten started on it sooner. Um, but one of the things I wanted to ask you about specifically is just the popularity of Napro technology. Because for a lot of young women, what I've noticed, again, I have no data, just kind of my own experience, a lot of women are really into tracking apps where they're like tracking their cervical mucus. They are also, tracking the type of bleeding that they have. They're using strips to measure their LH to figure out when they're ovulating. So it seems like, from at least from the patient side, that's why I get your perspective. From the patient side, it feels like a lot of women are kind of doing the Napro technology thing without all of the tools, but they really want to take responsibility for their health, supposed to being like, well, is birth control really the best option for me? So I just kind of want to get your thoughts on that, and seeing the rise of women starting to do these things.
I have absolutely noticed that myself. So we actually created an app. And our app is called NWH Cycle, like Natural Women's Health Cycle. And there were two things that really pushed me to make this app. One was the fact that when I went on several of these charting apps, I was so scandalized by the amount of information that was on those apps about all of these topics, which I did not feel were appropriate for teenage girls. And I have a teenage daughter, and I do not want her being inundated with information about, all these different topics.
I know
So,
exactly what you're talking about.
yeah,
Yeah.
so I
I'm
wanted
on
to,
these apps, so there's some of it
yeah,
that's not good.
so I wanted to create a safe space for moms and daughters and anybody so that when they come on the app, it's a beautiful app. It looks really cute. It's all pink and pretty, but it's a place where you can learn how to track your cycles without any prior information about what cycle tracking is. And it's a place where there's an entire video library that just goes through, what is normal bleeding? What is abnormal bleeding? What is normal mucus? What is a normal length of cycle? What does pain with a period mean? What do PMS symptoms mean? All these different questions that people have, just little 5-minute videos that kind of delve into it a little bit. And there are, a few blogs and courses and stuff like that. But when somebody gets on the app and they hit, the day on the calendar, I always advise them to use it at the end of the day before they go to sleep so that they can mark their observations from the whole day. The app just asks them questions and then the app will chart for them. So the app will ask them, are you having any bleeding today? And they'll say yes or no. And they'll say, okay, what are you using to collect the blood? And they have a whole list that they can choose from, regular tampon, super tampon, ultra tampon, regular pad, cup. The only two that we definitely don't want them using are the disc and the period underwear because you can't really gauge how much you're losing.
Is that the only reason why you guys don't recommend using the
Yes.
disc?
Yeah, I have a lot
Okay.
of patients that really like the disc because it seems to be more comfortable than the cup, but it self empties, so you lose that information, and none of them
Gotcha.
can tell me how much they're actually bleeding. Um, and then it will ask, how quickly do you fill this up? Or when you change it, is it half full? And then we have a little algorithm so that it can tell you, oh, this is very, very heavy bleeding. This is not normal. Or this is very heavy bleeding and this is not normal. Oh, this is heavy bleeding and this is normal. Or this is very light bleeding. Is it red spotting or is it brown spotting? Oh, that's abnormal. This is, you should seek help. So it at least is a place where people can begin to understand if their pattern is normal or abnormal. And then if there's no bleeding going on, it will ask them, or if it's just very light spotting, it'll ask them the questions about mucus. When you wipe yourself and you go to the bathroom, do you see anything shiny on the tissue? If you see anything shiny and you touch it, does it stretch? If it stretches, does it stretch 1 centimeter, 2 centimeters, 3 centimeters? When it stretches, is it clear? Is it cloudy? Is there any blood in it? And then it'll chart the mucus as well. So the patients may not understand exactly what those markings mean, right? But there's a little explanation underneath it that says you have very heavy bleeding or you have peak type mucus, this is a fertile time, and watch out for your peak day. They get little messages, and then they have the option of joining like a coaching so that we can look at their entire cycle and then talk to them about it or shoot them a message about it. But it's great because anybody can use it all over the world and it's free. And I think it'll be a really
Wow.
great resource as people get to know about it.
Honestly, I am super excited about that. That's probably because I've I can't tell you how many different like tracking apps that I've tried. And I have to be honest, like what you said was true. It's like you get very unnecessary, like inappropriate information that you don't necessarily want. But then there also comes a point where they're not user friendly, or they all kind of look about the same and they don't really offer like a ton. So we'll definitely make sure that we link that
Yeah.
tracker in the show notes if people want to,
Wonderful.
like
Ye-
myself, might want to check it out.
Yeah. I think the
So
other
that's really
issue
cool.
is a lot of the tracking apps are calendar based tracking. So you put in the first day of your cycle,
Yes.
they spit out a date of ovulation, which assumes that you have a 28-day cycle. And then when you put in the next first day of your period, it will change the last ovulation date based on this new cycle. So it's not accurate. And when people are using it, then, you know, they're just getting inaccurate information and making choices that are not the best. So,
Sure.
And I think it's important to
Yeah.
point out too, and you alluded to this earlier, Dr. Ribeiro, that with something like this that's doing a good job of helping someone be able to track their cycles, you actually can predict pretty accurately when ovulation is happening. Even if your cycle isn't following the quote unquote traditional 28-day cycle, where you're ovulating on day 14. And that can then be very helpful for women, again, either who are trying to achieve pregnancy or trying to avoid pregnancy, knowing exactly when that fertile window is. And so I think having resources like this is so helpful, not only for that, but also just so helpful for helping women truly understand their bodies. So to me, watching this whole um, movement almost, I think, develop over the last decade or so, it's become very interesting because it's made sort of interesting bedfellows, I think, in many cases of, um, women who maybe wouldn't necessarily associate with like conservative pro-life groups, but who are saying, I don't want to put exogenous hormones in my body.
right.
I realize the potential detrimental side effects, the impact on just brain function and mental clarity. I'm sure as well as I do. I mean, I don't even know how many women I've seen in the hospital over the course of my career who've had blood clots either in their legs or their lungs because of being on exogenous hormones, usually through birth control pills. So, all of those things. So, there are some women that are approaching this from a life affirming standpoint where they want to avoid, birth control pills because of maybe the potential for loss of life. And then there's others that just want to avoid that from just a basic health perspective. So, whether someone is wanting to avoid hormonal contraceptives from a sort of a pro-life perspective of wanting to avoid any chance of loss of life, or whether they just want to avoid the potential health consequences of being on birth control pills in particular. I mean, Monique, I'm sure you've seen this as well. I mean, I've seen patients in my office who were in their 40s and have been on constant birth control pills essentially since they were 15 or 16 years old. I just think it's really cool, actually, how this approach is bringing people from lots of different types of backgrounds together to say, it's really important for women to understand our bodies, understand how our bodies function, so that we can really maximize our health in the best way possible.
Absolutely. It's really lovely, honestly. It's a way, I think oftentimes, in the pro life community, in different faith based communities, we get a little bit sequestered
Uh-huh.
and we join with people who are very similar to ourselves. God has really kind of put me on a mission over these past few years to be in community, but imagine myself with kind of my back in this circle, but reaching outwards, trying to, invite other people in and help them to understand what we believe and why we do believe this. And in that journey, I have encountered so many people who have differing beliefs, who are absolutely beautifully made, amazing human beings that have amazing hearts, and they desire to live and a life that is natural and, honoring to their bodies. And we are happy to serve all of these people in our office as well. And we have a very wide array of patients. And the commonality is they value being able to understand what's going on in their bodies. And it's interesting because you were mentioning earlier about thyroid dysfunction. Even with that, what are we taught when it comes to thyroid dysfunction? Check a TSH and a free T4, but there's actually many other labs that we could be checking. TSH and a free T4 can be completely normal, and you can still have, that free T4 might not be converting over to the active total T3. It may not be able to bind to your cells because you have a lot of cortisol, and instead you're making reverse T3, which is blocking that binding. You may have nodules on your thyroids, which are a result of a lack of iodine. You may have thyroid antibodies that are elevated because of inflammation in your body. When we look at thyroid, we never just check a TSH and a free T4. It's always, a very in-depth panel and a thyroid ultrasound as well, once we know somebody has thyroid
Yeah.
dysfunction.
Yeah. Makes so much
That's
sense.
really
And
interesting.
man, makes me frustrated in a way of like wanting to go back and redo all of my training, because I could think back on so many patients that I had sitting in front of me in the exam room that you're talking to them about their symptoms and you're like, they're going to have thyroid dysfunction. Like I'm going to check their labs and it's going to show me that they are hypothyroid or hyperthyroid, and then you check their labs and it comes back normal and you're okay, well,
Yeah.
I guess I was wrong, but now what do I do to tell them about the source of their symptoms? So you just think, how often are we missing the full
Yeah.
picture of what's going on
Yeah.
with our patients? And and again, not faulting most doctors because it
No,
is
it's not the
poor
doctor's fault.
trade.
It's
Yeah.
it's the education. It's an issue with our education. And it's really, really interesting because our education was very much tied in with pharmaceutical industry, right? So pharmaceuticals would create a drug, then the drug reps would be in our offices and they're like, "Oh, this is it. You need to use this. This will solve all the issues, blah, blah, blah." And that's so much of how, especially after you leave medical school and residency, that's so much of how you continue your education.
Right.
We
Right.
do have CMEs and everything else that we go for, but you're learning day to day during those drug rep lunches how to actually serve the patients the best. And so often people are just utilizing these meds rather than looking for the root cause, not because they're bad doctors, but just because that's what we've been taught to do.
Right. Absolutely.
And yeah, it's just so much more fun. You feel like a true detective every day, and you really enjoy that aspect of it.
Yeah.
But
Yeah.
it's interesting that you say that because just over the past week, I've been really feeling called to create a program for physicians because I was trained in this way. And other than Pope Paul VI Institute, I had to kind of find my way and really do a lot of research into how other people were treating things, and then piecemeal together what I liked and what I didn't like. And then, luckily, I have an amazing patient population who's always really interested in trying new things and checking results and whatnot. So we've gained a lot of information as to what works and what doesn't work. So I'm just about to embark on creating a course for practitioners so that they can also learn how to transition over, how to understand how to read cycles, how to understand what basic lab work they should be ordering and how to interpret it. And I'm super, super excited to get started with this work.
Amazing. Well, we will definitely have to stay in touch with you about that then. And as that comes out, definitely talk to you more about that and offer, definitely be referring our members to that because I'm sure that there are so many that are interested, as am I. Well, I am so happy today to be joined by one of our sponsors from our recent national conference, the Matthew Bolfin Educational Conference. I'm joined today by Heather Vasquez, who is the Executive Director of Next Steps Pregnancy Services. They were one of our silver sponsors for our conference. Heather, thank you so much for joining us on Observations.
Thank you so much, I'm so excited to be here. Thank you.
Yeah, absolutely. Well, we're recording this just coming off of our conference. So it was a great time, and I know you were there and hopefully had a great time interacting with all of the people there and getting to talk about the important work that you all are doing. But for those that weren't able to be there and talk to you at the conference, tell us a little bit about Next Steps Pregnancy Services and what you all do on a day-to-day basis.
To talk about next step, it's one of my favorite subjects. Again, and Heather and I've been here for about 6 years, so we've had a lot of fluctuation in 6 years, but it's been a wonderful 6 years. We're in Linwood, which is a little city kind of about 20, 25 minutes north of Seattle, filling in the gaps, give or take. And I did some research just to kind of see how much really is between us and Seattle, and between the most well-known, Seattle and Bellevue and Everett, which are another couple of larger metropolitan areas. There's a good 35 to 40 miles of cities and towns and neighborhoods. And I have to say, there's not another accredited PRC of our caliber around. I feel like I'm proud of it, but I'm also sad that
Yeah.
we're few and far between Seattle and Everett, and the bigger areas. A bit about us. Our mission statement is pretty to the point, and we actually just changed it this previous year to really fit our core. And it's to offer compassionate care and material support to women and families before, during, and after pregnancy, no matter the circumstances. And it was just, our other one was kind of long. This one really fit because we're going to do what we can no matter what. And we very much focus on the before, during, and after pregnancy. We offer completely free medical services and supplies, which may otherwise be out of reach. So we have very generous supporters and donors that amazingly sustain us each year so that we can continue to offer all of this completely free of charge. We've been around since 1998, offering life affirming care, and we were accredited in 2023. So that's been pretty wonderful. Our services include early ultrasound and pregnancy testing up to 20 weeks. And we also offer a full panel of STI testing and treatment. We do reproductive loss grief care that our nurses are certified in to work with, and that's post-abortive and miscarriage care. And there's been quite the uptick in miscarriage, so they've really honed in on that. We also do abortion pill reversal, and I was so happy to meet Dr. Delgado at the conference and talk with him and share that we do that. So abortion pill reversal has been pretty huge, especially here in Washington with, I think it's over 70% now of the abortions here in Washington are medication abortions. And so I feel like we're so perfectly in the right place right now to be offering that. And we're one of the few prescribing clinics that do that. So it's been our medical director, Dr. Stephanie Stoke, I'll give her a plug, is wonderful. Her license is on the line, and she stepped right up to it. And last, we're actually not just a clinic that does medical, but we offer practical support as well and material supplies for maternity, newborn, and toddlers. And we've been doing that the whole time. There'd been talk of going to strictly medical, but the need is there. The need is there. So we continue to hand out, over 5,000 diapers annually. So we get lovely support from the community to hand those things out as well. Yeah. So that's kind of what we're currently doing. We do have some new stuff coming up, but I didn't know if you had a question.
Yeah, no, that's amazing. So great to hear. I think pregnancy centers like yours, especially those that are accredited, which is, I know something that more and more centers are pursuing, which we at Applog definitely support, because of course we know that even those that are not accredited are not the fake clinics that abortion proponents like to claim that they are. But I was talking to somebody recently who is a pregnancy center medical director who his clinic is accredited. And he was at a state hearing, I believe it was in Oregon. and Planned Parenthood was there as well. And they were accusing him of running a fake clinic. And he said, well, we're triple AHC accredited. Are you? Planned Parenthood was not accredited in any way. And so it really is amazing, I think, to just show the kind of quality care that you all are providing for women. Before we get into some of the new things that you all are doing, what's your average number of clients and patients that you serve each month,
Um,
if you had to guess?
yeah. I mean, I was looking at, I usually look at it in a yearly basis. I always get
Mhm.
asked monthly, and for some reason, I'm always thinking yearly. And I know that we do, gosh, between 350 ultrasounds a year our nurses are performing. Our STI testing isn't as much as I'd like, probably a good 20 a month, not even that really a month, as much as like the near the university. That's picking
Mhm.
up. But that's and then we've got a big handful of, as I said, the reproductive loss
Yeah.
couples and just folks coming in. So those are our, I think ultrasound's probably our main
Yeah.
medical thing so far that we're
Yeah.
doing. Yeah.
Yeah. So
Mhm.
amazing. And the fact that you're providing these services for free so that a woman's ability to pay doesn't impact the care that she receives at your center, which is so amazing. Um
Those are great.
yeah. So tell us about some new things that you all are working on or what you're most excited about for this upcoming year.
We just started offering FEM, cycle charting support, and I went through the program, and then we've got a couple of gals that are FEM instructors, and so that was exciting to start because although our focus a lot is pregnancy, it's early, so we're really trying to talk with the gals long before they even come to us for a pregnancy test, and so we felt like the cycle charting support and body literacy is definitely the way to go, because the more you know about yourself, the more empowered you feel, the more respect you have for your own body, and the more you know that you're a cherished daughter of the king,
Yeah.
obviously, and that we don't offer contraception here, so but our nurses are well trained and ready to talk about contraception and the dangers of it, whether it be physical, emotional, spiritual. And I thought, we kind of thought along with talking about that, we need to give them alternatives. And in the past, had been kind of, well, natural family planning is safe for the married couples, and unfortunately, we have a lot of folks coming in here that are just not. They're not coming from that kind of a background, and so that's not, so we didn't want to keep that from them, to keep the way that, you know, keep the natural way from them. We wanted to make sure they were aware of how beautifully and wonderfully they're made and how God made it so perfectly well that you don't need that extra stuff and that a period is healthy, things like that. So we're excited to be offering that to the young women. And we're launching our new website this month. We got a great one through Extend Web Services, but we've got a new one that we're working with a group called Life Advancement Group,
Okay.
and they're a pro life marketing group, and they've been fantastic. They really got me thinking. I feel like a lot of folks find us, but I wondered if we were missing the woman who literally has the abortion pill in her hand, or
Mhm.
is looking for an abortion. She's not thinking about it, or unsure. She is trying to make that kind of appointment, and I wanted to make sure they could find us. And so, Life Advancement Group has helped us get in front of all of that. And so we've had a real uptick in people contacting us who, again, are still somewhat unsure, but they're leaning a lot more toward abortion than some of our other clients. And so it really made us step up our game on how to address that, and how to talk with them, and but also to stay transparent. We don't offer that. We don't
No.
perform it or refer for it, but here's what we can do for you. And so that's been pretty huge, and it kind of knocked us back a bit to realize how many young women just in our community alone were missing us completely and going to the Planned Parenthood 2 blocks down. So we're excited about that, and we're hiring because we're so busy that we need to get another nurse to do ultrasounds because we're just booked out, because everyone is part time but me. So we're trying to fit more of that in and fit more work in for nursing, and then also getting another MD or nurse practitioner to possibly help with other things. So we're doing a lot, and I want to make sure we're offering the best care and the most options during the week for gals.
Yeah, absolutely. Well, so crucial too that you be available, like you said, and be able to be found by women that are right in the heat of making that heat of the moment of making that abortion decision potentially. Not only so that hopefully she realizes what all of her options are and can be empowered by knowing that she has that support. We know that so many women choose abortion simply because they feel a lack of support. And so not only so they know that there's support there, but also in case she does start taking those abortion pills, that she can know about abortion pill reversal, which of course we
Yeah.
know is very time sensitive. So, and I love that you all are doing the FEM model. I think um, body literacy and empowering girls and women through that is so important. Regardless of the choice that they make, even if women decide to go on and take contraception, I still think it's important for them to have that information. But of course, oftentimes having that body literacy information will allow them to be able to manage and monitor their own cycles, make better choices for themselves without needing to take or do anything else. And so that's so important. And Dr. Karen Poyalos, who is one of the heads at FEM, is an active AppLog member, and the work that they are doing is so great. So that's really wonderful. Um, can I have two more questions for you? One is, if you just briefly, if you can think of, what's one maybe patient or client encounter that really stands out in your mind that you think would highlight the importance of the work that you all are doing at Next Steps?
Definitely, there was one very recently, and she contacted us via the Life Lead app, which was another component of what the Life Advancement Group was helping us with.
Okay.
And she texted into us checking in, and it was in the evening. It was like a Monday evening at like 9 o'clock. And just the desperation in her voice of, I need to get an abortion. I'm looking for an abortion. I want to abort my child. And she actually texted out the words abort my child. And I just kind of froze because I was, it was just so raw, and I think that w- w- she found us, thank goodness. And where else is she going to go? And just the desperation in her voice was very heartbreaking. And to see I don't want to say indifference. Some people say, well, they're just kind of indifferent nowadays. I don't think they're indifferent. I think the fact that she could type out the words abort my child is very telling in how their mind works right
Yeah.
now, but it
Yeah.
doesn't mean indifference. It's just,
Right.
yeah, I don't know what it is. It was heartbreaking to me, and I was kind of reeled back by that
Yeah.
line.
Yeah.
So yeah, and
Yeah.
I'm so happy that somehow she landed on us.
Right.
Um, yeah,
Right. Well, I think it shows, as you said, the desperation that she felt, that she recognized that was her child, but still felt like maybe that was her only option. And so, as you said, thank goodness she was able to be connected with you all, because we know if she showed up at Planned Parenthood, she would have been pushed likely into one decision, and that is to get an abortion. And so, and of course, pregnancy centers like yours provide women with so many other better options for them and for their child as well, and not just until that baby's born, but well beyond as well. And so we're so thankful
I'll be honest.
for so many pregnancy centers, and thankful for you alls as well, not only for serving women in a place that is very dark. But also, we're thankful to you because of your sponsorship of the conference recently. We would not be able to do what I think is a very amazing conference for so many people if we didn't have sponsors like you all. What made y'all decide to be a part of the conference this year and be a silver sponsor?
Yes. Well, it definitely was great that you were here. When I saw that it was in Seattle, I was like, "Oh, I'm there," because I've been following APLOG. I mean, I've always found it. I've been in healthcare for about 20 years, so I've anything healthcare fascinates me. So I was so happy to hear that you guys were going to be here, and I just felt how important as it was said at the conference, how important the voice of the doctors is. I was so excited to hear about this coming, and that I'd be able to hear these speakers and meet these folks. The gathering of the doctors and the other medical folks and the organizations coming together in solidarity behind the sanctity of life. It was really beautiful. Most especially by the medical students walking around. They looked so young, and they looked so excited and energetic, and seemed very interested in coming back to Washington, because I kind of jokingly said, when you're done, come back to Washington. And I was really not kidding. Please
Yeah.
come back to Washington.
That's right. That's right. Well, I certainly hope that we can return there one day. And it was so wonderful to be there with you all. Of course, we partner with a lot of pregnancy centers. So thankful to partner with you all. And of course, as you said, you guys could use some help. So if we have any members out there who are listening, who are in the area, please reach out to Next Steps. Speaking of, how can people find out more about the work you all are doing or contact you if they're interested in getting involved?
Sure. Our website is really easy to find, because it's nextstepnw.com. And that's how to find us and all of our services. There's a link on there also to go to our support site, if folks are interested in volunteering or donating or just learning about kind of the behind the scenes. So that's the best way to find us. Just Google Next Step Pregnancy Services, and there we are. Best way to find us.
All right, perfect. And we'll put your website in the show notes for today's show as well. Heather, thank you so much for joining us on Observations. Thank you so much to everybody at Next Steps for being a part of MBEC this year, and we look forward to continuing our partnership with you all.
We hope that you enjoyed today's episode of Observations and that it broadened your perspective on women's health and how we can care for both patients, mother, and preborn child. If you like this episode, make sure to give us a 5-star review where you can find your podcasts. Make sure that you like this on YouTube and subscribe to our channel for more episodes coming up. And if you have any suggestions on any topics that we should cover or guests that we should have on, make sure that you email us at media@applog.org. Again, thank you for joining us for today's observation, and we'll see you in our next episode.